Okay, guys, let's talk about what you're going to teach the patient that is on anticholinergics. But before I start, I'm going to ask you, please help support me. Help me get to that 100K. I'm almost there on YouTube. So go to YouTube, Nexus Nursing. Check me out. If you're a nursing student, tell a friend about it. I'm trying to help you guys. All right, anticholinergics. So for dry mouth, difficulty swallowing, you're going to teach them frequent mouth care, mouth oral hygiene, and to suck on sugarless candy or chew sugarless gum. And the sugarless part is very important because you're not trying to turn that patient to a diabetic. All of a sudden they're hyperglycemic and they'll be like, oh, Professor D told me. No, I said sugarless. So you're going to teach them to do that for the dry mouth. Now for the blurred vision, the sensitivity of light, remember that's a safety issue. You're going to teach them to not operate heavy machinery, not to drive, make sure they're keeping the floors clear of clutter, make sure they can wear like dark sunglasses to, protect their eyes. For urinary retention, you're going to tell them to make sure they avoid that teach them to make sure they void right before they take that medication. Look at what it says. Take the drug just after you've emptied your bladder. That's going to help with the urinary retention. For constipation, remember they have constipation. When it comes to anticholinergics, can't see, can't spit, can't pee, can't, right? So for constipation, you're going to tell them to drink lots of fluids. You're going to tell them to move around. You're going to tell them eat foods high in fiber. And for flushing, intolerance to heat, sweating. Remember, with anticholinergics, they cause decreased secretions. You don't sweat. And remember, sweating is part of the mechanism that helps cool you off. So with this patient not sweating, we want to make sure that they don't become hyperthermic. So you're going to teach them to avoid temperature extremes and don't exercise, because when you exercise, normally you sweat. That's what helps cool you off. The patient taking anticholinergics, they won't be sweating. So that mechanism to help cool them off is not there. So while they're on that medication, you're going to teach them, try not to exercise.